This is Matt ZAHN, and I'd like to welcome everybody back for day 2 of our Forum of Microbial Threats workshop that's entitled The Critical Public Health Value of Vaccine, Tackling Issues of Access and Hesitancy. I'm Matt ZAHN, and on behalf of the Planning Committee, we appreciate you listening in. And I'd like to start by briefly recapping yesterday's meeting. We had presentations that reviewed vaccine confidence worldwide and how it may relate to the age of COVID. And specific topics also that we reviewed included principles for improving immunization uptake, reviewing the importance of identifying particularly not just state or countrywide immunization rates, but in specific communities and communities of need. Addressing equity issues, including gender equity issues that can affect immunization access, the critical need to develop adult immunization programs to respond to COVID, and the importance of identifying and reaching out to community leaders. And finally, we had a couple of excellent presentations that talked about different ways to optimize our immunization program outreach. And that includes partnering with pharmacies, in communities, and use of mobile health cell phone options to reach out to people as well. So, I think that overall the meeting yesterday highlighted both the large amount of work ahead worldwide we have, not only to improve our immunization programs, but also to catch up for all of the immunizations that have been missed in people worldwide in the age of COVID with the lack of medical access. At the same time, I think we also identified and talked through real opportunities to improve our immunization programs or immunization outreach, not just to potentially provide a COVID vaccine of the future, but also to improve our immunization programs worldwide for a period to come.